It's been great to be back at a proper conference, to meet people we haven't seen for 2 years, and I guess we've all been sick of Zoom conferences, and finally we are back to live action. So edge-to-edge repair for transcatheter approaches to treat tricuspid regurg is the approach we have the most experience with, most cases worldwide. Although it's not that easy, it is relatively straightforward to learn. It is an extremely safe procedure, and as long as you select the patients right, you can be very effective in reducing TR with that approach. The biggest challenge, especially when coming from the mitral side and having already experience with mitral interventions, is the imaging. Imaging is much more difficult on the right side of the heart, and that's probably the most relevant to it. And then you have 3 leaflets, so you have to make a decision which leaflets you would like to connect and approximate when you do your procedures. And what should also be not forgotten is that the tricuspid valve leaflets, they're quite fragile, they're quite vulnerable, and you have to take care during your procedures that you do not cause any injuries. The bRIGHT study is a registry. It's still ongoing, but here we look at the first analysis of 200 patients who had a procedure performed using the Triclip device. And we see, again, a great safety profile, very, very few complications. We see that in the vast majority, we were able to reduce tricuspid regurgitation, at least by 1 grade. And 66% had moderate or less tricuspid regurgitation. But it's important to also mention that they started off, many of these patients, with tricuspid regurg grade 4 or 5. So 90% had grade 4 or 5. Encouragingly enough, again, we see a clinical improvement, which comes along with the TR reduction, and that's demonstrated by an improvement in NYHA class. We see improvement in quality of life. So it all points towards the right direction. And also from the clinical experience, whenever you are successful in reducing TR, then you see clinical benefit. The significance of these findings as compared to the initial TRILUMINATE trial is that we can confirm the safety and effectiveness of that procedure, but now in a less restricted environment, unselected patients, much more centers, and also some centers which went through a learning curve, but despite that, the same good results. There are many unanswered questions so far. I mean, we started only a couple of years ago and we made great progress already. At the moment, I'd say that the most important points to improve is patient selection, both from a clinical point of view, but also from an anatomy point of view. So we still have to figure out in whom the procedure might be too late and whether we have to intervene a little bit earlier. And then anatomy, assessment of anatomy. It varies from almost every patient, and we have to get better in selecting the right anatomies for the different transcatheter approaches.